Hi, this is Dr. Saxena, and I've been talking on some issues, particularly what are the things which really help. It looks quite small, and this how it impacts you. And let's see. Uh, been talking on this always on the kind of toxicity from the food, toxins of air and water. I would like to talk on today, or would like to talk on something like toxicity, which has been the problems which have been faced by these artificial colors, which are added to the food basically, the food, the fruits, and all that. See, basically, we it's always it received a great deal, and in recent years, but once some of them have been removed from the market by the FDA as early as 1970s. Something like red dye number 2 was removed after test showed it causes cancer in experimental animals. Um, the thing is, it was a relentless work by someone called Stephen D. Locke, and in the late 40s, they warned that artificial colors in the drugs were one of the major sources of the health problems in adults as well as children. To prove this assertion, I started looking into. See, I've been associated with a thing called environmental medicine, and this particular doctor, Stephen D. Locke, what he has warned in 1940 that the colors of that thing. You get that red capsule, you get that bright red some things, and you get green capsules, colored coating over that particularly capsules and all that, or over the tablets, which can be something like colors are added. Of course, there are something like tartrazine. There are some other things also, but I'd like to give you a practical demonstration. I picked up three sensitive chemically sensitive patients who had something like multiple chemical sensitivities. They needlessly they used to get into some kind of sinus problem or headache problem. If they used to, they get that if they someone is uses a DO, or they have that chemical sensitivity. These three patients were blindfolded. We didn't tell them what we are giving. We gave a glass of spring water to drink to one of them. Into each glass, this normal water was given, and into each glass added some amount of this food coloring capsule, or whatever capsules which are we got from the market. One was red and black, and one was white and blue, and so we just picked up three random things, and it's usually contains that usually that gelatin capsules, what we call. With this, we tried working on this. Needless to say, I have always maintained in our practice, we ask people to take that gelatin capsules intact, not intact. We ask them to cut that capsule, make a rent over that, and pour that liquid. It can be something like primrose oil, something like a guanylonic acid. All these things has to be our patients know how they deal with that particular stuff. So when this particular thing was given, two of them had a severe reactions, and the person who had a placebo, he didn't get into the person who didn't took much this particular thing. We didn't give them this thing. He was quite okay, but the other things were people had some kind of reaction. So I've been of late I've been talking about coloring of foods, coloring of fruits. Fresh fruits is a problem, particularly oranges, and you have something like this is naturally colored oranges are slightly greenish in tinge, and they with this particular addition of the colors and all that, they make it quite bright for that. It is basically for the purpose of selling the fruit, and Similarly, sweet potato also can be thing, but we are concerned about not just the coloring of the fruit and all that, even the content. The cartoons where this fruits are being transported, like mangoes or oranges and all that. There is a lot of fungicides which have been sprayed, a lot of insecticides which have been sprayed in the carton, and you get that particular thing, and you keep on, it keeps on outgassing and causes some problems. So you have to look out for things which are chemicals in the food, and you have to always this is a real thing. And I'd like to give a case study. I'd like to show you one of the cases where we were working with patient who almost in his 15 plus age. He had some autism like symptoms were there, but he was on follow up. He was doing phenomenally well. 16 plus something like that, he was doing quite well. And as he went to the college and all that, he started taking a lot of not much food. He used to do a lot of snacking and take a lot of colored artificially colored drinks and all that. And I go to any restaurant now, the first thing they offer is that mocktail, and it is nothing but all the colored things. And I'm really concerned about how I'll show you how this child had gone from taking that particular thing, and he had suddenly, all of a sudden, he had episode of fits. And this being a family of they went to the neurophysician. They advised a EEG and a CT scan. Everything came back normal. He was given a kind of, he was recommended to go for, but his seizures continued, and he was recommended to go for a psychiatrist was recommended. And the parents were slightly educated in the sense they sensed I work on this particular thing, and they were on a follow up with this one. So they came back to me and they said, what can be done now? So I used to talk a lot about food allergies and all this stuff, and maybe that thing they came back to me. I asked him, the parents, not to give any soft drinks to the child. All sugars were banned, and all the products made from that grapes and colored fluids, mocktails and all that were totally taken out. Then I slightly reintroduced this into his diet one by one. Chemically uncontaminated grapes, then commercial grape juice, and various kinds of sugar. And there was no reaction. In fact, he felt better, and he was doing for months. Then we gave him a big glass of that mocktail, junk food, that thing which he was addicted. And within minutes he fell down on the floor, and his body stiffened and went into and what looked like a typical epileptic seizure. When he recovered a few minutes later, and I discussed the cause of the seizures and fatigue with him, with his parents, and we told them this is what is the cause. It is the chemicals in the environment, and especially food, that is causing symptoms. And if this child wants to regain his strength and foods, he has to stay away from all these contaminated foods and other major exposures. Of a kind of thing, needless to say, he was being put on all this stuffs, and he recovered quite well without any much things. This emphasizes what exactly these colored things can do to your health, and it can cause to a kind of even the normal kids are not spared. And we need to look into this as a environmentally sensitive thing, and colors in the food are a real issue. and we would like to focus on that, because these colors can also be the cause of cancers later also. So this is regarding this colors in the food. And if you happen to use some colors, there are a lot of colors which were banned, and in this part of the world you are not aware about that. Please don't use colors, and try to see that all the mocktails and all that red dyes and all that which is added to your chicken and all stuffs, even for your paneer and all, be careful in using that particular stuff. It may taste good, but over a long run it can cause, if you are environmentally sensitive, if you have some multiple chemical sensitivities, you will definitely get into a big issue. And you need to stop using this colors into the food. And the industry also has to be warned about this particular thing. And let's start in a healthy way. We have been talking about how to maintain your health. That's more important than not getting a disease, because maintaining a health is an ongoing challenge, and we are living in this world which are full of toxins and all that, and we need to take some extra precautions and work it out. That way we will be in a better shape. Thank you.